Hello everybody, I'm Farina and you have probably seen a previous video by myself talking about frontal lobe meningioma surgery. So today I'm just trying to give you an update of how I'm doing 4 months post-op, that is 4 months after the operation that I had in February. First of all, I'm doing very well, and that is the most encouraging thing that I can say to you. I am back to work 3 months and 20 days after my craniotomy, which is fantastic because most people would take 6 months off, and I do recommend that they do, but because I felt very well, I thought I will go back and start working part-time. And the thing that has actually brought me to talk today is that this morning I had an inquiry from somebody, I don't know what age or which country she's in as yet, but she was asking me whether or not she should go ahead with the surgery and mentioned the tumor size to me. Now, my advice is that, listen to your neurosurgeon, but also make up your own mind as to what is better for you. Because in the first place, I think it is a symptom that would have led to the scan and the diagnosis. If you are experiencing problems already, I think as the tumor gets larger, it is possibly going to cause more problems. And a planned surgery is probably better than a surgery which is done as an emergency. Okay, so that's that. And of course, there's comments there to make if you would like to ask any further questions. And coming back to myself, I have full recovery. I have no neurological deficit, which means that I have no sensation loss or power loss or any kind of visual disturbance. I have no complaints really, it couldn't have been better. As far as the pain is concerned, yes, headaches come and go, but they're bearable and painkillers do take them away. The next thing I'm going to talk about is how do you feel after the surgery? I think emotionally it's a big shock. And I haven't been depressed, which some people I hear do. And I've heard people being concerned about putting on weight from the steroids. But on the contrary, I've lost a considerable amount of weight, which is great. And I think it's very encouraging that you look well. As you can see that, my head and my face look completely normal. There is a little bit of a bulge in the temporal area, where they basically took down the temporalis muscle to expose the skull and go into the brain. But all that is fine. It's pretty much bearable, and for the entire operation, I think it's a very small price to pay. The other thing after surgery is that you feel very, very thirsty. And even now, I'm very thirsty, and an iced drink is always by my side. So that's what you should expect. Some people say that they sleep a lot. In my case, I was completely the opposite. I was awake most of the time, not because of pain, but possibly because of medication, being steroids. They kept me awake, and I was happy enough as long as I didn't have the pain, because the headaches were incredible. You have never experienced anything like it. I wouldn't think you have. Then people have asked me if I can color my hair or how long it takes after the operation. If if the scar is healing, in my case it was healed, they advise not to use hair color or strong perfume shampoos. So in the initial couple of weeks or months, I would advise that you would need to get some baby shampoo and use that. At a social level, I think you probably won't be able to engage in conversation with people for a considerable amount of time, because talking and interpreting the information and then having to articulate into words what you want to say, that is a little bit hard on the brain. And I think, a quiet room, possibly with dim lights, it would be very helpful. I really don't know what else to update you on today, because I need queries from you to answer. But what I'm planning to do is to make short videos on subjects that are relevant. For example, pain, post-op management, and how to cope with it emotionally, physically, psychologically, things like that. So thank you very much for watching today.